Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Back in the Hydration with Heart segment brought to you by Once Upon a Coconut, live from My Heart headquarters. I'm thrilled to introduce two trailblazing figures who are redefining wellness and healthcare accessibility. Dr. Joe Puma is a renowned interventional cardiologist with over 3 decades of groundbreaking work. As the founder of Sorin Medical, Dr. Puma has not only pioneered life-saving heart scans, but has dedicated his practice to improving cardiovascular health access in underserved communities. Joining him today is Kenya Gipson, nationally syndicated host of Passage to Profit and co-host of The Check-In. She's also known as the Marathon Mama. Kenya's wellness journey has captivated audiences nationwide, inspiring others with her message of empowerment through movement and mindset. Together, she and Dr. Puma launched The Check-In. It's a healing series to bring vital health resources to the hip-hop community and beyond. Today, they're here to discuss heart health, transformation, and a mission that crosses boundaries. Welcoming now to the show are my dear friends Kenya Gipson and Dr. Joe Puma. Welcome to the show, superstars.
Great to be here. Thanks for having us, Sen.
Yes, very excited. Appreciate the opportunity.
Okay, we're going to dive right in because there's so much to unpack here. I'm going to start with some basic statistics. So according to the American Heart Association, Black adults are 30% more likely to die from heart disease compared to their white counterparts, and that's partly due to systemic barriers in healthcare access. So, Dr. Puma, you've made it a real point to advocate for minority health in underserved communities. What first led to this mission, and how has it specifically, I want to know, shaped your approach to making cardiac care more inclusive?
Well, that's a great question. And, if you spend your life in hospitals every day, especially here in New York City, which is really diverse, you get to see patients from all different backgrounds. It really hits home that we have a problem. There are real disparities in care. And while I don't want to be political about it and talk per se about race or poverty and things like that, what I do want to do is just recognize that, when your kitchen is on fire, we shouldn't be, spending a lot of time talking about a leak we have in the bathroom. And in underserved communities, in the Black communities, the kitchen is on fire. They have a higher incidence of heart and vascular disease, which is the #1 killer worldwide. They have worse outcomes. They come to our attention, Zen, when they already have more advanced disease. They have more complications. So in my little world, at least, I've tried to find platforms and ways to educate, to raise awareness, not to preach, but to try and embrace people where they live and help them with their healthcare journey to improve their heart health, ultimately making them feel better and live longer.
It's so refreshing to see a specialist like yourself step outside traditional roles to really focus on health equity, because no one is really doing it. And in a healthcare landscape that's often criticized for its inaccessibility, especially for minority communities, your commitment really offers a powerful example of how healthcare can move from reactive to proactive in supporting these patients. So kudos to you. Now, Kenya, I'm going to focus my attention to you for this one. So there was a recent survey from the National Institutes of Health, and it revealed that only 23% of adults met the recommended physical activity guidelines, with even fewer from underserved communities. So you're a marathon runner and a wellness coach who's overcome some health challenges, but through movement mainly. Can you share how your coaching philosophy is designed to break down mental barriers in communities that may lack access to fitness resources?
For sure. So movement is medicine, right? I think if you're moving around for a few minutes a day, whether you're walking up the stairs or you're taking a jog around the corner, I think it's important to just start where you are. I've been in the fitness industry for the past 10 years, and I will say I was not always a marathon runner. I didn't start that way. As a matter of fact, I used to despise exercise. Wasn't my favorite thing to do, but realizing that I had underlying diseases in my family like diabetes, hypertension, things like that, I knew that I had to get active, and I knew I had to create an active lifestyle in order to really, come against some of those comorbidities that we experience later on in life, particularly as a Black woman, right? So one of the things with me is that I just felt like it was important to find an authentic space where I could create some mindset coaching, get people to think past their limitations. Marathon running was a big, attribute to that, where I was able to get out, run. And I found that when I was running, that I wasn't thinking about a lot of things. I was just thinking about the one thing that I was doing at that particular time. So when you take the mindset or the thought process of running and you make that applicable to your mindset or getting past a certain goal or threshold, I think that they're both intertwined. And I've been able to use running as a method to kind of surpass and create some tenacity in my life. So that's kind of
wow.
my journey there.
I love how you tied that together. It's actually really inspiring when you backtrack and look at this journey, and more importantly, your emphasis on mental barriers. That's key, because studies really tell us that our mindset often dictates our ability to stick to health goals, right? And so for communities with fewer resources, that mindset shift, it's everything.
Mm-hmm.
So what you're offering isn't just, your perspective. It's an invitation to transform on both a mental and physical level. And so I commend you for that. Now, when you look at the statistics here, studies show that patients from marginalized backgrounds are often less likely to seek medical help due to past negative experiences with healthcare providers or even certain stigmas within their communities. So, Dr. Puma, the check-in series is taking healthcare right to the community rather than waiting for people to come to you. How did you and Kenya decide to create this initiative, and what impact are you hoping that it's going to have on the trust these communities feel towards the healthcare system?
The key thing was that, sometimes you're lucky in life and you meet people that not only are like-minded, but are authentic, are sincere, and have passion, as well as compassion. And because of that, we started to understand a little bit better, having many conversations on many different platforms with patients from these communities. And what we found, basically falls into, I think, two different categories, and it's a male-female issue. On the male side, tremendous fear. Just a fear of even finding out. Women, on the other hand, probably not a surprise to you, are way more informed and way further ahead of the curve. They go to the doctor, but there's no easy access. They don't have high quality care in their community. And what really came through was that it appeared that even though they expressed themselves, they articulated their problems, it didn't seem like anyone was listening and acting on what their issues were. And so we've been really fortunate in that we feel like we've had a great impact on a number of people's lives. There are people walking the earth today because we've started the programs we've had and the partnerships that we had. So the question becomes then, how do you reach a broader community? And that's where the idea for the check-in came. And so what we wanted to do is we focused on the hip-hop community. The hip-hop community, as you know, is losing a lot of, great people and great artists prematurely. Fat Man Scoop in his 50s, while he's performing, has a cardiac arrest. A lot of it has to do, I think, with education and awareness. And so what we wanted to do was try and merge entertainment stories, real stories about real people that have accomplished things in their life, but at the same time, talk about their health journey and the challenges that they've had in their life.
So refreshing to see health professionals like yourself really taking that step forward, and more importantly, reaching out directly to the community. So creating a proactive trust with communities is extremely important. So you're on the right track. Now I'm going to shift back to the check-in from Kenya's perspective. So when you look at minority health and health disparities, nearly 60% of Black and Hispanic adults lack basic health resources. So Kenya, through the check-in, you're bringing both education and physical resources to hip-hop communities and beyond. How has partnering with Dr. Puma and Mano helped you amplify this mission, and what's been the most surprising reaction that you've encountered so far?
Well, that's a great question. I would say, in addition to resources and education, we're creating access, right? Because that's the result of everything that we're doing, right? Making people realize that there is an option for them when it comes to their health care. It's not as unaffordable as you think it is. I think there's a lot of misconceptions when it comes to, the healthcare space and like what's affordable and what's not. And I think that there is this stigma, particularly in communities of color, that we can't afford certain things. But I also say that we culturally spend money on things that don't make a lot of sense, and we need to make sure that we are taking care of our health. So can I mention the Sorin Marketplace? Am I allowed to do that?
Yeah.
Sorry. So ironically enough, the Sorin Marketplace has a setup where you can go on there and you can really see how affordable it is to get the scan with or without insurance. And I think accessibility and information is important because it shows you that you're not being left out, right? I think that people think that they can't afford certain things. And when you can physically see what's available to you, it shifts your mindset. And just to your point about working with Mano and Dr. Puma, I think one of the things that was most intriguing to me about Dr. Puma when I first met you was your heart for the community, and your heart for people who don't necessarily look like you, right? And I felt a certain sincerity from you, and I felt like as a human being, like I gravitated towards that, and that just showed me how authentic you were. And I knew from there that we could build what we're building now. And I mean, this really started with the Breakfast Club, right? And it's evolved into this thing where now Mano's involved. And I think he brings a certain, dynamic to what we're doing that's real and relatable. And I just feel like we all contribute to the puzzle the way that it was meant to unfold.
Now, the CDC has found that preventative care could reduce the economic burden of disease by nearly $270 billion annually. Yet, many communities still lack access to early diagnostics. So Dr. Puma is pioneering this space without a doubt and pioneering accessible diagnostics. So how do you view the role of technology in bringing proactive health measures to those without easy access? I mean, could tools like your Sorin heart scan eventually become a bridge for these communities?
Well, they ought to be. And the real question is, why aren't the large institutions doing this, right? Why is it that a small independent medical practice like Sorin Medical is the only practice in New York, whether it's hospitals or practices, that has the most advanced CT scanning? Right. We trademarked it, the Sorin heart scan, because A, it's the most advanced and fastest CT scan. And when you image the heart's moving, so you need super fast imaging. B, we have the most experienced technicians and nurses that have been doing this for over 10 years, just focus on cardiovascular disease. And 3, our process, the medications we use and the process to lower the heart rate to get the best images, as well as the fact, number 4, that most scans are managed and operated by radiologists in hospitals, and we're operated by cardiologists and only focus on cardiovascular disease. We image only the heart. But what technology is supposed to do, right? Every several years, our computers get faster and they get cheaper. Well, that's what technology should do. And imaging in medicine is doing that, but we're not bringing it to patients. A simple 3-minute scan with our technology, covered by insurance, no cost out of their pocket, can give them such context that I promise you, if they walk into our office or any place in this country and get a scan at this level and this quality, they will automatically be able to live longer if they take those results and use them properly.
It's remarkable to consider that technology, right, is the bridge that finally closes these health gaps. And too often, high-risk communities are just left behind when it comes to innovations in healthcare. So your work feels like a giant step forward, really leveling the playing field, and that's both refreshing and inspiring. Now, according to the American Psychological Association, people who set health goals with community support are 50% more likely to maintain these goals long term. So, Kenya, your journey is an incredible testament to resilience. How do you incorporate mental wellness alongside physical activity, especially for those who are dealing with challenges like chronic illnesses or socioeconomic stress?
Well, I just personally took a mental health week myself last week, and I wasn't sick or anything. I just needed a break. And so for me, I just think when it comes to mental health and it comes to health in general, it's not really a color thing. It's a personal choice thing. And when you realize that you have options for you available, you start to choose better when you know better for yourself. So for me, I think it's important to teach people how to put themselves first, how to put their health first, right? That you are important, and that, if you're not well, most likely the people that are around you, your family, your friends, your community, they're not going to be as well off, right? So I'm trying to teach people how to take care of themselves just from a spiritual level, a mental level, and then a physical level, because I feel like it's all cohesive and it all works simultaneously together.
So often the wellness industry focuses only on aesthetics or quick fixes. But from what I'm understanding, your approach speaks to true sustainable transformation, and it's something that goes beyond the surface, and that's where real change happens.
Thank you.
Good job.
Thank you.
Now, research, we're almost at the end, but research from the American College of Cardiology suggests that high-tech diagnostics, like the Sorin heart scan, you have the potential to lower mortality rates by up to 20% if accessible to all. So while the Sorin heart scan is a cutting-edge diagnostic tool, it comes at somewhat of a premium. What's your plan to make this scan truly accessible to those even without insurance or substantial financial means?
You know, we live in New York City, and there are so many very wealthy areas in New York City, and I certainly don't begrudge anyone their hard work and their wealth. However, they're juxtaposed against equally poor and highly impoverished areas, right?
Yeah.
And so the real question, though, is, but we're all people. Why shouldn't everyone have access? But what we see in New York City, and what you see even nationally now, is all these companies with these high-tech scans that are targeting the wellness and longevity market, so to speak, and the kind of the 1% or the 0.1 of 1% that could pay $2,000 or $3,000 or $5,000 for this scan. Whereas from my perspective, listen, Medicare pays us $195 for a Sorin heart scan. We're willing to take insurance on anyone. We want to, the way you create access, I like to say, is by creating access. The way you meet people that have, that are underserved is by going to meet them where they live. There's absolutely no reason that the entire population, rich or poor, black or white, can have these preventive scans if they're in a high-risk subgroup. There's no reason that the facilities can't accept their insurance. There's just no reason for it. And there's no reason, by the way, that all those rich folks spending all that money, $2,000 and $3,000, can't just use their insurance and not have to put anything out of their pocket. We can reduce mortality by 20%. If you've lost a loved one, it doesn't matter how old they are, right? I think both my parents have passed. I would give a lifetime of tomorrows for one yesterday with both of them.
Oh, yeah, that's so true. And it's crucial. I mean, I think this is a crucial piece, what we're talking about, making sure that access isn't a privilege, but a right. And the cost of advanced healthcare is often such a barrier. So it's reassuring to hear that accessibility is on your mind. Now, Kenya, you're an advocate for community-based wellness. Can you share a moment from the check-in series that highlights the power of community in achieving wellness transformations?
Probably the episode that we did with Lady Luck.
That's exactly what I was thinking, because that's real community.
Yes. And it just came from a very organic place, like how it all came about with us, finding out about her condition, her being so transparent with our audience about like what she was struggling with, and literally it's coming out and saving her life, right? Like it was very full circle, and that like it just was remarkable how that all came to fruition.
She was near death, but you talk about communities and not to cut you off, Kenya, but it was just conversations, small conversations in informal places, and then someone caring about someone, making a call, having a text, and literally I think she's on this earth today because of those conversations.
Yeah. Thank you both so much for joining us. Dr. Puma, it was a pleasure having you here. Thank you for contributing to the Expert on the Microphone series.
Zen, thanks so much for having us, and thanks for making us part of your community and all you're doing for healthcare.
Yeah.
Definitely check out Coach Kenya. You could head to coachkenya.coach or check her out on the gram at Coach Kenya. That's spelled with a Y, Kenya. And Dr. Puma is at Sorin Medical NY. And you could head to their website and check out how affordable this scan truly is, sorinmedicalny.com. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by Once Upon a Coconut.
Discover the refreshing taste of 100% pure coconut water that actually tastes great. Naturally sweet with no artificial flavors or added sugar. It's packed with electrolytes to keep you hydrated throughout your day. And with 10% of profits going to charity, every sip makes a difference. Pure taste, pure goodness. Experience nature's Gatorade. Visit Once Upon a Coconut or naturesgatorade.com.